It started with a small, dark spot on my shoulder. Nothing alarming, just a mole I'd had for years that seemed a bit different. Maybe slightly larger. A touch darker. As a retired nurse with over 30 years of experience, I should have known better. I should have acted sooner. But I told myself what so many of us do: it's just a mole. It's nothing to worry about. That small spot turned out to be melanoma, the most dangerous form of skin cancer. And my story is one that thousands of seniors face every year. Today, I want to share what I've learned, because what you don't know about your skin can quite literally cost you your life. And what you do know might just save it. You know, it's funny how life works sometimes. For 3 decades, I was the one in the white uniform, teaching patients about preventative care and the importance of early detection. I'd examined countless suspicious moles, referred patients to dermatologists, and even held hands with those facing skin cancer diagnoses. Yet somehow, I missed the signs on my own body. I first noticed changes in what I thought was just an ordinary mole during a weekend at my daughter's beach house in Florida. After a lifetime of sun exposure, those teenage years of baby oil and iodine, those gardening sessions without sunscreen, those vacations where a tan was the ultimate souvenir, my skin had accumulated its share of spots and freckles. But this particular mole had evolved. The edges weren't as clean as they used to be. The color wasn't uniform anymore. When my daughter commented on it, I brushed it off. "It's just sun damage," I said. Nothing to worry about. 3 months passed before I finally made an appointment. 3 months that could have made all the difference. As healthcare professionals, we learn about the ABCDEs of melanoma detection: asymmetry, border irregularity, color variation, diameter larger than a pencil eraser, and evolution or change over time. My mole checked nearly every box, but I'd convinced myself it wasn't serious. Skin cancer is the most common form of cancer in the United States, with more than 5 million cases diagnosed each year. And here's what many don't realize: our risk doesn't decrease with age, it compounds. Every sunburn, every tan, every unprotected moment in the sun adds to our lifetime UV exposure. For those of us over 60, we're seeing the consequences of sun behaviors from decades ago, when sunscreen wasn't a daily habit and tanning was considered healthy. The damage done in our youth often doesn't reveal itself until our senior years. There are 3 primary types of skin cancer: basal cell carcinoma, squamous cell carcinoma, and melanoma. While basal and squamous cell cancers are more common and typically less aggressive, melanoma, the kind I had, is the deadliest. It accounts for only about 1% of skin cancer cases, but causes the majority of skin cancer deaths. The dermatologist didn't mince words. After examining the mole with a dermatoscope, she said we needed to biopsy it immediately. I could tell from her expression that she was concerned, but still, I clung to denial. "It's probably nothing," I told myself. Just being cautious. When the phone rang a week later, I knew before answering. The biopsy confirmed melanoma, stage II. It had penetrated deeper than the surface layer of skin, but thankfully, there was no evidence it had spread to my lymph nodes. I sat in my living room after that call, staring at the family photos on my wall, my children, my grandchildren, my husband of 45 years, and for the first time, I faced my mortality head-on. Would I be there for my youngest granddaughter's high school graduation? Would I celebrate my 50th wedding anniversary? That moment, that heavy, breathless moment, changed my relationship with my skin forever. The weeks that followed were a blur of appointments, procedures, and recovery. The surgical excision removed the melanoma, along with a significant margin of surrounding tissue. The scar on my shoulder is about 3 inches long, a permanent reminder of what almost went undetected. For many skin cancer patients, especially those with melanoma, treatment doesn't end with surgery. Depending on the stage and depth of the cancer, treatments may include immunotherapy, targeted therapy, radiation, or chemotherapy. In my case, I needed additional immunotherapy treatments to ensure any microscopic cancer cells were eliminated. Recovery is both physical and emotional. The physical pain subsides, but the emotional vigilance remains. Every new spot, every change in an existing mole triggers anxiety. Is it happening again? Did we catch everything? This is the reality for skin cancer survivors, a heightened awareness that can be both exhausting and life-saving. My experience as both a nurse and a patient has taught me that early detection is everything. Here are the warning signs that should prompt an immediate visit to your dermatologist. 1. Any mole that changes in size, shape, or color. 2. Spots that look different from all your other spots. Dermatologists call this the ugly duckling sign. 3. Moles with irregular, notched, or blurred borders. 4. Moles with multiple colors or uneven color distribution. 5. Any growth that continues to increase in size. 6. Spots that become itchy, tender, or painful. 7. Lesions that bleed, scab, or don't heal within a few weeks. For seniors specifically, be particularly vigilant about rough, scaly patches that persist, especially on sun-exposed areas like the face, ears, neck, arms, and hands. These could be actinic keratoses, precancerous lesions that have the potential to develop into squamous cell carcinoma. As we age, our risk for skin cancer increases substantially. By age 70, 1 in 5 Americans will develop skin cancer. This isn't just because of cumulative sun exposure, though that's a major factor. Our skin's ability to repair DNA damage from UV radiation diminishes with age. Our immune systems become less efficient at identifying and destroying abnormal cells. Certain medications common among seniors can also increase photosensitivity, making our skin more vulnerable to sun damage. These include some antibiotics, diuretics, diabetes medications, and even over-the-counter pain relievers. Additionally, many in our generation simply didn't have the sun protection education that's common today. We came of age when sunbathing was glamorized, when outdoor activities rarely included sunscreen application, when a deep tan was considered the picture of health rather than what we now know it to be, the skin's response to injury. One of the most dangerous myths I encounter is the belief that sun protection doesn't matter anymore for seniors, that the damage is already done. This simply isn't true. While we can erase past exposure, we can absolutely prevent further damage. Studies show that regular sun protection at any age reduces the risk of developing new skin cancers and can even allow some repair of existing damage. It's never too late to adopt these habits. 1. Apply broad-spectrum sunscreen with SPF 30 or higher daily, even on cloudy days, even in winter. 2. Wear sun-protective clothing, including wide-brimmed hats and UV-blocking sunglasses. 3. Seek shade during peak sun hours, typically 10 am to 4 p.m. 4. Avoid tanning beds completely. They dramatically increase skin cancer risk. 5. Perform monthly skin self-examinations using a mirror for hard-to-see areas. 6. Schedule annual skin checks with a dermatologist. Remember that sun protection isn't just about cancer prevention. It's also the most effective anti-aging strategy available. Many of the changes we attribute to normal aging, like wrinkles, age spots, and leathery texture, are actually signs of sun damage. After my diagnosis and treatment, my oncologist developed a surveillance schedule that I follow religiously. For the first 2 years, I had skin checks every 3 months. Now 5 years out, I'm seen every 6 months. These regular screenings have caught 2 more suspicious areas, both precancerous and easily treated before they could develop into something more serious. This is why I tell everyone in my senior living community, screening works. For most adults over 60, an annual full-body skin examination by a dermatologist is recommended. Those with a personal or family history of skin cancer, numerous moles, or significant sun damage may need more frequent checks. During these examinations, don't be shy. Make sure your doctor examines every inch of your skin, from your scalp to the soles of your feet. Melanoma can develop anywhere on the body, even in areas that receive minimal sun. Exposure. One challenge many seniors face is navigating the healthcare system to get appropriate skin care. Medicare Part B covers annual skin cancer screenings if you're at high risk or if you have symptoms, but many are unaware of this benefit. If you're concerned about a spot, be persistent. Don't let anyone dismiss your concerns with "it's just an age spot," or "we all get those as we get older." You know your body best, and changes that concern you deserve professional evaluation. I've learned to be my own advocate. Before appointments, I photograph any concerning areas and track changes. I bring a written list of questions. I ask for clarification when I don't understand something. And if I'm not satisfied with the attention given to my concerns, I seek a second opinion. Remember, healthcare providers are partners in your health journey, not the sole decision makers. Your observations and intuitions matter tremendously. The psychological impact of a skin cancer diagnosis shouldn't be underestimated. Many patients, myself included, experience a complex mix of emotions: fear of recurrence, guilt over past sun behaviors, anxiety with each new freckle or spot. I struggled with guilt after my diagnosis. As a nurse, shouldn't I have known better? As a mother who slathered sunscreen on my children, why hadn't I protected myself with the same diligence? These feelings are common, but not productive. What helps is channeling these emotions into positive action. I've become an advocate for skin cancer awareness in my retirement community. I organize annual screening events. I speak at senior centers about the importance of sun protection and early detection. Finding purpose in my experience has been healing. Each person I convince to get screened, each grandchild I protect with sunscreen and sun protective clothing, each conversation that raises awareness feels like turning my diagnosis into something meaningful. My journey with skin cancer began with 5 words I wish I could take back. "It's just a mole, nothing to worry about." Those words nearly cost me my future. Today, I'm grateful for early detection despite my delay, for excellent medical care, for the years I've had since my diagnosis to watch my grandchildren grow, to travel with my husband, to enjoy the retirement I worked so hard for. If you take one thing from my story, let it be this: your skin deserves your attention. Those spots, freckles, and moles tell the story of your life. You're sunny. Vacations, your outdoor hobbies, your years of living in your unique body. Pay attention to their changes. Protect the skin you're in now, regardless of past habits. Schedule that skin check you've been putting off. Start using sunscreen daily. Examine your skin monthly. Talk to your loved ones about what you've learned today. These simple actions could save your life, just as they saved mine. Remember, when it comes to skin cancer, what we see on the surface is just the beginning of the story. Early detection isn't just about extending life. It's about preserving the quality of the life you've worked so hard to build. Thank you for listening to my story. Now I hope you'll act on it. Your future self will thank you, just as I thank that dermatologist who didn't dismiss my changing mole as just another spot. Because sometimes, it's not just a mole. And knowing the difference can make all the difference.